credit belongs to the man who is in the arena. Dare greatly and build intentionally. Welcome to In the Arena Podcast. Welcome to In the Arena Podcast. We're live at the 4th annual Arena Collective Real Estate Continuing Education at the Covington Beer Garden. I'm not wearing this hat because I'm a realtor now. I'm wearing this hat to show off the swag that we gave to the realtors today.
Good stuff.
Everybody in the world can know you're a realtor and that you got a little Arena Collective here to give you a little bit of swag. You know what I'm saying? All the kids like these two-tone hats with the logo on the side. That's all the rage, these things. We clock it whenever we talk about that?
Clock it. You got to clock it.
Love it.
Right?
So, we had a bunch of great sponsors today. I cannot thank you enough. This is not the first time we've done an event together, and you're not the first time you've done our podcast. So if you want to learn everything you want to know about DPC Plus, you can go to our social media page and find the long-form episode we did with you guys. But I want to talk about what y'all have going on now. And you made an announcement today. I won't say it's the first time you made the announcement and nobody knew about it until today, but we're going to act like that. Like, just dropped here. And y'all are opening up another location on the South Shore.
Yeah,
Tell us
well,
about that.
I think a big thing to cover is we've had a significant change and growth since the last time we've talked.
Oh, really? Okay, tell me about it.
Metairie has been a challenge that we've been approaching from different angles for a long time.
Yeah.
I think we finally have the growth. Well, I don't think. We do now have the growth to where we're just funding it ourselves now, which is better than working with partners, which is how we were trying to do it in the past.
Yeah.
But even with that big, huge announcement that we're now in 3 locations on both sides of the lake, that comes with the other announcements that we also now have prescription coverage for our people at 0 cost.
Wow.
Very cool.
We have specialists on retainer now, so our patients see specialists for free. We've expanded our services out to membership now covers their full annual labs for free. We don't charge for point-of-care diagnostics anymore. We don't charge for the medications in-house anymore. So our services have become more and more robust, and our membership fee really covers everything unlimited.
That's awesome.
That's awesome.
And we continue to grow and try to add more services to that even. We hopefully will soon be announcing our white-labeled, our proprietary app as well. So one of the confusion points is downloading Spruce, our communications app. Soon it'll be a DPC Plus app.
Very cool.
So super excited about everything we've brought to the table.
DPC Plus, what y'all do, just to kind of give everybody a little synopsis, I'm going to do this in plain English, so not from a medical standpoint. I'm a lawyer, and my dad's a physician, but I still know nothing about really the medical world and how the business operates. But if you're a member of the group, if you're a member of DPC Plus, all things you just said, I can get as a member of that organization. I pay monthly, right?
Right.
And I get to go get checkups. I can have some emergency things done, not heart attack, stroke related, or my bones hanging out of my body. But if I need a suture or I have my kid's not feeling good, we can go to y'all's clinics. The nurse practitioners are there. They're going to help you get people dialed in, get you feeling better, and you can get your prescriptions now. Get your annual labs now. So, you can be a member of y'all's organization and get all these benefits and not have to wait in line at the doctor or have to pay all your co-pays and all that kind of stuff to be a part of y'all's organization.
Sure.
Correct?
Yeah, I mean, look, insurance has its place. I think I don't want to say it fear-mongers, but insurance is always supposed to have been for catastrophic events.
Yeah.
It has evolved from there to encompass everything and anything that people need medically, and you end up spending a whole lot of money to have it. You spend even more money to use it, and the reality is healthcare doesn't have to be expensive.
Yeah.
But when you bundle it with everything else and you pool the risk, it becomes expensive.
Yeah.
What we've done is we've just taken that non-hospitalization, super expensive piece out. So 90% of what people use healthcare for is what we do.
Yeah.
So we use a simple subscription. Everything's included, unlimited utilization. If you want to come and bother us 30 days a week, do it.
Nice.
Because there's only 2 possible things that can happen. Either we see you enough to where there's nothing left to fix, or we identify real big risk factors, and we can protect our people from long-term catastrophic events by getting ahead of them.
That's awesome.
And, this is Elizabeth. She's our provider out of Covington. Our providers don't have 4,000 to 5,000 patients like your typical insurance-fed doctor's office. We have a cap at 800 patients. So there's no, I'll see you in 2 weeks. It's most of our people walk in. They get seen same day most of the time. If it's not, it's because they called us 5 minutes before we close, and we'll see them in the morning. But They have after-hours
Relate to
coverage
that.
as well.
Yeah.
We don't have the, hey, I need a refill. We'll see you in 2 weeks to do the refill. No, we'll just do it. We don't need the insurance claim. We take care of our
Yeah.
people.
So
It's a totally different
Let's
approach.
talk about that. I mean, as an actual practitioner, what drives you to work for an organization like DPC Plus and to go work for somebody else?
Well, I did work in a traditional setting before, and the every 15-minute appointments, and feeling like even having to say to patients, I need you to prioritize 2 things that you wanted to talk about on that list because we don't have enough time to cover all of the things. And that's not what we're in healthcare for, right?
Sure.
You know, so you don't really get to be an active listener, and you don't really get to be proactive in all those screenings because it's time sensitive. You're like, I got to roll this over, you know, and there's never enough time in the day. You don't really get that personal relationship. And so for me, this made sense. Like, this is what I want to do for healthcare. And I think primary care is a perfect setting for this because I think a lot of people are disillusioned with the traditional healthcare setting for primary care.
The thing is the only option. They don't know enough about, and you said it earlier today, they didn't realize that this is even something that you could have access to.
Well, they're used to the big systems where they're not going to see the same provider. It's whoever is available, and it's a, you know, revolving door. And so they say, you know, I have to tell my story all the time, you know, have to redo all of my history. And so they just get frustrated with it and then don't want to go.
Yeah.
And so here I want them to want to come in and talk to me. And then they feel like it's that real relationship where they know I know them.
Yeah.
And so if something's really wrong, we're talking through it. I'm not saying, I really wish we could talk about this, but we got to keep it to 2 problems today.
I think it's great because, I mean, and you can hold, it's accountability too, right? You see someone who comes in and they're sick and you know why, you have a conversation, a relationship, you can be a little more direct about, let's be honest with you yourselves, like, this is why you're still feeling this way. And you can have more of that one-on-one coaching, consulting, give you the medical advice you need type relationship.
Well, and I learn them and they learn me.
Yeah.
And so I know the ones that are going to take down the notes but not actually do it.
Yeah.
And so then we can just work through why aren't you doing
For sure.
it and kind of get through that barrier
That's
of
awesome.
like what's keeping you from getting healthy.
Yeah.
You know, so I think it's different in that it's that personal relationship, but they're not having to spend a fortune to get that.
Yeah. Well, good. I hope more people learn more about what y'all do because I think it is unique and I think it is valuable. Now, does every direct care provider have a social media presence like y'all do, or is that unique to y'all's company?
No, I think there's a lot of things in the direct care space that we do more of and better than other providers. I would say as a general rule, and I'm not judging anybody's practice because we all have our priorities, but most doctors who get into the direct care space, they're doing it because they're used to that 5,000, 4,000 patient panel, and they just want out of that.
Yeah.
They don't want to build a network. They don't want to build a big company. They just want out of the system that has destroyed their career.
Yeah.
And so they get their, 2,500 patients. It's half of what they're used to working, and they're happy, and that's what they want to do. We are maniacally obsessed about building a network that grows throughout the nation so that when our patients from Louisiana travel to Florida, they get the same experience for the same membership. They're not paying to be seen there, and we're removing all of those thresholds of care. The pain threshold of, do I have a copay and how long does it take to get in? I'm a DPC Plus member. They're in every state, and I'm going to the provider while I'm here visiting in X state, right? And so social media is a part of that, but it's everything we're building. We're trying to duplicate this in every city that we touch so that we address the system. Our mission isn't to lower the workload of one provider. It's to change the system and make sure we're creating an impact on the whole thing.
Awesome. Before we hop off, this is important to us that we hear about what you liked about this event and how what people can experience when they come. So what was your favorite part of the event and how did you get value out of this as a sponsor?
Yeah, I'll tell you what's unique to us is we've come to a lot of events where we've been a sponsor or otherwise, but we've never stepped away while the key demographic was inside learning doing their piece. We got to step away and learn stuff that's relevant to us as the business owners and the sponsors. And that was really special for me to see.
Cool. Well, I appreciate y'all coming and sponsoring. You did great on your first podcast. You did great again on your second. We'll probably do this all the time. I appreciate both of y'all for coming on.
Thanks for having us.